shall we go then? Sorry, just also just wanted to let you know that just for the purpose of anybody who hasn't been able to attend this meeting today, just to be able to hear it back again, we are recording the meeting. And as usual, when we go into that sort of final session, any questions and answers, we'll take the presentation off the screen, and you'll have the opportunity of the chat box to do some discussions, or you can just simply raise your hand and we'll come to you. So I'm then just going to switch the agenda around slightly, and if we can come to you, Joe, just to talk us through COVID booster and the flu vaccination programme.
Great, thanks, Sue. So what I'd like to do today is share with you some information on what we've got, particularly around communications on COVID booster and the flu vaccination programme. So you'll be aware that this is, of course, a national campaign. It affects everybody, and it's very much of the topic at the moment. The NHS are really pushing for people to make sure that they're getting their boosters when they're invited, and also their flu vaccinations as well. And it's never been more important as it is this year as well. I know that there has been some myths out there that actually we shouldn't be worried about flu because we've not really seen any in the last year, but that is definitely not the case. And we need to do all we can to make sure we're minimising the cases that we've got, especially in our area. So I will just be able to show you today, first of all, if you're, gone backwards. First of all, to show you who is eligible for both the booster and also flu vaccinations this year. So booster, first of all, then, is going to be, you will be invited if your second vaccination was over 6 months ago. So we do need to leave that gap in between you having your last dose and the booster. So it is particularly for those people, it's for all adults over age 50 and 50 years and over, but it also includes all of those aged 16 to 49 with underlying health conditions that put them at a higher risk of severe COVID infection. Also those living in residential care homes for older adults, an adult carer, adult households that's got contacts of immunosuppressed individuals, and frontline health and social care workers. So they are the people that will be receiving invitations for boosters. And I'll come on to next about how you go about booking if you're invited. Then when you look at flu, which we've put next to each other, just to make it clear, and again, you'll get a copy of this presentation. Free flu vaccinations are for those people that are aged 50 and over again, and some certain health conditions as well. Also, if you are in long stay residential care, if you receive a carer's allowance or are the main carer for an older adult or disabled person who may be at risk if you get sick, which means that you wouldn't be able to deliver the care that you are able to for the people that you live with. Anyone that lives with someone who is more likely to get infection, so for example, such as someone who's got HIV, has had a transplant, or is having certain treatments for cancer, lupus or rheumatoid arthritis. Again, frontline health or social care workers, if you're pregnant, and for children aged 2+ to 11 years as well, and their parents. So that really is the eligibility list. But if you want more information, you can get that on the nhs.uk website, which goes through that as well in a bit more detail. So sorry, I just managed to mute myself there. If you are eligible and you see yourself on that list for the COVID booster in particular, the NHS will contact you. So it'll either be via your GP practice, or you may get a letter or text from the National Booking Service. So this won't happen until it's been at least 6 months since your second dose. And also, of course, the GP practices are really, really busy at the moment. So if there is a bit of a lag, that will be why. So don't panic, you will receive information about booking. If you have been invited, you can also go to walk-in clinics that are advertised as being for boosters. So you could either go to a GP practice if they're delivering that, or the walk-in clinics. Now, you would get turned away if you haven't reached your 6 months. So again, it's really important that you wait for that invitation, and don't worry if you haven't received it yet, but they will come to you. And for flu vaccination appointments, it's very similar in the fact that if you're eligible for the flu vaccine, your GP practice will contact you directly. Now, again, just pointing out that fact that if, as they are, practices are doing flu and COVID boosters, it might take longer to get through to everyone, but they will come to you. And if you are eligible for the free jab, you don't necessarily have to go to your GP practice. You can also get it at a pharmacy. But for more information, if you want to read any more, there is a website there as well, which you will get when we send this out to you. There are a number of GP practices that aren't going to be delivering the vaccination programme going forward. They may have delivered it initially, but they've chosen not to in the future. You will be told of where you can get the booster vaccination next time round. So again, they'll make it very clear to you that they're not delivering this time. So what I wanted to do is share with you some of the advertising that we're doing. So we have had a couple of requests actually for, where is all the literature? We're hearing lots about it. You want everyone to get vaccinated. It's that time of year. What are you doing? So these are images that have come from our national campaign, and you'll start to see these get populated. However, this is not all we're doing. So a brand new campaign is just starting locally. We're really working fast and furiously to make sure that we're delivering this locally, and we're doing what's very much appropriate to our population. So you will see this, but you'll also see lots of activity locally happening and within your GP practices or just in your local areas like pharmacies. So pharmacy, for example, is one really key area that we're going to be focusing on in Leicestershire and Rutland, and you'll start to see that happen. But we have unfortunately had to wait for these to come through, and these have literally come through in the last week. This particular poster, as you can see, is covering flu and COVID. So where you see what looks like a Ready Brek line, I suppose, which will remember some of us, is the blue line around the individual. That is where we're focusing on flu vaccinations. Where it's COVID booster, it is that orange line, and where it's both, we're talking about both. So you'll see a combination of both. And, where we're really focusing on flu, we'll be focusing just on the blue and so on. We do have a number of different images for different populations, and they do vary. But again, you'll start to see some of these appear, and these are brand new to us. So there's just another example there. And again, this is very much focused on pregnancy and children. And there's another one again. So there's lots of different ones, and we will pick and choose depending on what's appropriate for our audiences locally. Now, of course, we're really keen for you to assist with this where you can. And we are putting together a digital toolkit for you. As I say, this is hot off the press. I think this came through on Thursday or Friday of last week. So that is being done behind the scenes at the moment, and we will send those out to you as soon as they're ready. So that's anything that you can do to help us digitally, whether that's on Facebook, Twitter, Nextdoor, where some of you do promotion and so on, or on websites. We will also have posters available, and if you would like any of these, please email us and we'll make sure that you've got those as well. We have what we call email signatures, which go on the bottom of our email signatures. Again, if you want to use those, you can do. So again, anything that you want from us, we can make sure you've got those, but we will get the digital toolkit out to you as soon as it's ready. And there will be digital screens as well that go on in your GP practices. So when some of you, you're in practice and you're waiting for appointments, you'll see those pop up similar to what you've seen. We're going to be doing a radio campaign, particularly in some of our local communities as well. So this is not all we're doing, it will be supplemented, and we're really going to be starting pushing out, working with our local communities on how we make sure that people are aware that they're you know, it might be in their own language, or that they're just really familiar with the process and the eligibility criteria. So we are working on that at the moment. You might have noticed just down the bottom, our normal email address has actually changed, and all of that, and some of you will be aware that our emails have changed. We're just moving to a system at the moment where we're using nhs.net accounts. So some of you will have our old email accounts, but we're just switching over at the moment, and that's one of them. Be Involved is our generic inbox. It's slightly different. If you email the wrong one, it will still come to us, and over time we will transition. So that's our new one, but like I say, it will come through anyway to us if you've got any requests. So hopefully that is clear on eligibility, how you'll hear about the boosters, how you can get hold of posters, and we'll send the digital toolkit out to you. As and when we get updates as we develop, we'll come back to you. We're now meeting once a month for an hour. If you feel that you want us to do a bit of a longer session on it, absolutely we can do that as well. But I just wanted to give you an update on where we are with those two items. So I'm going to pause there. I know that we've got Rachel that's joined us, so I'm just going to whiz back on the presentation. And Sue, I wonder if you could just reintroduce Rachel for us. That'd be great. Thank you.
Yeah, that's lovely. Thanks for that, Jo. So if we could just sort of hold just any questions around the booster and COVID information. And then we can cover those after we've heard from Rachel. So Rachel, I know you're hot off the call for the system, so I hope you managed just to take a breath before jumping onto this one. So I'm delighted to be able to welcome you to the group, really just to have a bit of a discussion with us about what it's like at the moment in urgent and emergency care system, and hopefully to talk through with the patient participation group members how they can support us with perhaps some solutions to some of the current issues. So Rachel, welcome, and over to you.
Thank you, Sue, and good morning, everybody. So yeah, as Sue introduced, I'm Rachel Dewar, and I have the role of Assistant Director for Urgent and Emergency Care across Leicester, Leicestershire and Rutland. So I work with all of our NHS provider partners, so primary care, our acute trust and our community services, as well as our social care services. And my focus is on making sure that the service is able to respond when patients have urgent or emergency needs. But obviously, capacity all across our service is really important to be able to meet those needs. So our current situation is we're really busy. Actually, all of the sectors of our health and care services are very busy. Primary care have seen an increase, so GP practices have seen an increase in activity. And whilst they're continuing to see patients face-to-face and virtually, we're hearing a lot from people around concerns around being able to access primary care. So that's one of the areas that we're working on with primary care, to make sure that appointments are available on a primary care level for patients when they need them. We've also got our urgent care centres and our urgent treatment centres, and again, the activity that they're seeing is higher. So they are booked appointments primarily, where patients can go, booked in through contacting 111 if they have needs outside of primary care hours, or if the GPs direct people to 111 or to a hub rather than going to the practice. And then, of course, we have our emergency department, which is for people who have more significant immediate needs, which require a kind of consultant-led response. And I think that our focus really is around helping people to make the right choice about where to go. What we are seeing at the moment is some quite significant waits in our emergency department. Particularly in an evening, we're seeing up to 50 people every hour attending without going through any other process. So just walking into our emergency department, and the knock-on impact for that, particularly if the patients don't need that level of care, is that the department becomes very busy and we end up with delays to patients who require a higher level of care because we need to triage all of those patients. And we have already seen some waits on ambulances for patients who are transported to the hospital by ambulance, which we wouldn't ordinarily expect to see until quite significantly far into winter, actually, and then sort of fairly unusually. So I think what we're saying at the minute is it feels like we have hit the winter levels of demand much sooner than we would ordinarily. Our COVID activity does continue, and whilst we are lower than the national average across LLR for COVID currently, only just, we do still have a number of people in our hospital beds who have COVID, and we are still needing to take measures across all of our services to make sure that people stay safe when they are attending our services. And that means that sometimes appointments take longer than they have previously, or we have additional levels of triage in place to make sure that we can offer the right care for those patients. We've got a number of services that are underused, and community pharmacy is one of those, actually. So what we're finding is that people are tending to access the higher level of services, even though there's going to be significant waits for them. What we really would like to have is advice and information from you in terms of how you feel we can better communicate with people around making choices that are going to mean that their needs are met in the most appropriate way, because we don't want to be in a situation where anybody is waiting long periods of time for their care. The daily figures for COVID are that we have currently, I think, 12 patients in our intensive care unit beds. We have 12 COVID beds in our community hospital, and we have around about 40 to 50 patients across UHL who are COVID positive. So there are current numbers. So that's a bit of an introduction for you, but what I'm really interested in is the questions that people have, or any comments that people have that they think that we would be able to use. So I'm using your expertise, really, if that's okay, to help us to help people across Leicester, Leicestershire and Rutland.
So thanks for that, Rachel. We've already got sort of a couple of questions coming in. So I'm either happy to read them out, or happy for you to come in. So Alan, I don't know, Alan Markfield, do you want to come in and just ask your question in terms of COVID cases?
I think she's answered it, Sue.
Okay, no problem. And I think we've got Alan Plumpton.
Yeah, just clarification, really. You made reference to people using a community pharmacist. I don't think people are very clear about how that system works. Am I right in thinking that you approach that by going to your GP surgery and the receptionist will direct you to the community pharmacist, or is that just a walk-in system that you're talking about in terms of going to any chemist or pharmacist?
So you can approach the pharmacist directly, or you might be directed there by your GP receptionist, or you might be directed there through 111. But you can, if you have a question or a need, and you don't require emergency care or urgent care, you're feeling a little bit unwell, you've got something that you want to go and ask a question about, our pharmacists are really well qualified to support with kind of those low level needs, and you can directly approach your pharmacist without going through other means.
Am I right in thinking though that certain pharmacists have better services available to them than others? So it's not every chemist that we're talking about here.
So yeah, we have a community pharmacy service where we have some pharmacists who are signed up to providing additional care, and that's the referrals on from 111. But for very minor issues, any pharmacist will be happy to give advice. If you have a pharmacy in your village, they are always very happy to give advice. And I've certainly sent my older daughter there before now, when she's come and said, oh mum, you know, I'm not quite sure what this is or that is. Go and talk to the pharmacist first and see what they say, and you know, they will either recommend something or they will say, if they think that you need to have that checked out by a doctor, they will also give you that advice.
Okay, thank you.
Many thanks, Alan. So I've just got Jan, you've got your hand up. Jan, do you want to come in with your question?
Yeah, I'm just trying to put my video back on. There
Okay, lovely. Welcome, Jan.
Thank you. I was really interested with Rachel saying that you're working with GP practices on access for appointments. That is a massive thing within our practice, and that's where we get the most negativity, which obviously compounds lots and lots of issues within the practice. I was wondering if there was anything that Rachel could share with us now that we could take back as a PPG and further develop. So any suggestions in that way, shape or form would be greatly appreciated.
Okay, Jan, thank you for that. So the conversations that we're having with lots of primary care networks and practices at the moment, we have some areas who are testing something called access at scale, and that's where a few practices are getting together and kind of sharing their resources to have appointments coming through, so that gives an efficiency of scale, if you like, with more people available to answer the phone and to help with booking appointments, and a system whereby reception staff or care navigators can book appointments for a number of practices rather than just one practice. So that's something we're testing to see whether that improves the patient experience. The other things that we're talking to primary care about is making sure that they have alternatives available for everything else. So if they have alternative ways of patients doing things like booking future appointments or ordering tablets and repeat prescriptions, then that means that their telephone activity becomes less, and so patients ringing for a same day appointment are more likely to get through. So they're the kind of things that we're hoping primary care will be trying and testing, so that on a daily basis what they can do is keep their phone lines as free as they can for the people that need to ring to be seen that day, rather than ringing for routine things that could be sorted out a different way.
So, I mean, it's a really good point, Jan, as well, because one of the other things that I do think that PPGs have been really successful at in the past, but obviously COVID prevented stuff from happening, is also around the self-care messages, and as you know, if you were on the call at the last meeting, we shared our patient survey, and it really became apparent that those self-care messages were important, people wanting help and support to look after themselves where it was appropriate, where it was appropriate condition. So I think, Jan, it's a really good point that you have brought up, and we would very much like to work with all the PPGs on that. And we've got our colleagues in, we're part of obviously the overall communications and engagement team, and we've got our colleagues in communications supporting information around that self-care element. So we'd be delighted to come back and share that with you and talk to PPGs about how they can actually really actively get involved, because as I say, you've been so successful in the past.
I think that's right. And Sorry, Jan, I would just finish off by saying that what happens a lot, so where we have got patients going down to the emergency department or A&E, lots of them are saying, oh, well, I'm here because I can't get a GP appointment. But then when you talk to them, they haven't tried to get an appointment, but what they're hearing in their local communities is that you can't get a GP appointment. And so that narrative is creating a behavior and a truth that people aren't necessarily testing out. So, you know, where I think you are really kind of influential and successful is, you know, you get an opportunity to talk to people at a slightly different level than sometimes we do. And most of the conversations around how good healthcare services are don't come from healthcare providers. They come from the local community having normal conversations in normal places. So that's the thing that's really important to me, is that messaging to people around trying and finding their own truth and not necessarily relying on other people's experience, because it won't necessarily dictate theirs.
It's the self-care message, I think, is the key for us, because we're a massive practice. We're a 27,000 patient practice, so I think sort of you know, spreading out the access isn't appropriate for us. The ordering of medications, prescriptions, we don't do that via the phone anymore, with a view to freeing it up. But with the self-care messages, we were promoting those when we were doing meet and greet, and it was getting through. You didn't necessarily have to see a doctor, you could do that, and that was really working. But of course everything froze. But if there's any help at all, or any literature or anything at all about the self-care piece, then that's something we could really actively promote. So we really appreciate that.
We'll make sure that we're getting that out
Thank
to you. So I've got 3 other questions on the screen, and then I'll come to ones in the chat box. So I've got on my screen, it's just iPad 2.
Hello, that's me, Julie Walker.
Hi, how are you?
Yes, all right, thank you.
Good.
I'd like to go back to these telephone calls to the GP surgeries. This is fact, not made up or anything else. An 83-year-old friend of mine tried for 3 days to get through to the surgery. In the end, her daughter took her to the surgery. They gained access to the surgery. The whole time they were in there, that telephone never rang once. When my friend was ringing up, it cut off. It rang once and it cut off. Now that told me that phone wasn't switched on. Anyway, but the receptionist, while they were there, managed to speak to the GP to get a prescription done. So that proved that the doctor wasn't on the phone either. I do believe there is something seriously wrong in this case, something seriously wrong. I think that, you know, dodging is perhaps not the right word, but I do feel that some surgeries are not taking this extra phone calls or seeing patients because they want to sit there and do the backlog of the paperwork. I am not complaining that there are, you know, I know they're busy, but that to me makes me feel that our GPs, not mine, but GPs in general, and people in the ivory towers think we're stupid enough to believe everything we're told.
I would absolutely hope that that's not the case. And one of the things that we are working on is making sure that we have activity data and information available to us so that we can see the number of appointments that each practice is having on a daily basis, and how many of those are same day appointments and how many of them are planned appointments. And it is really important that we have that level of assurance from primary care as well as for everywhere else. I am so very sorry to hear that experience of the people that you know, and that's obviously not what we would hope for. There are some practices whereby the calls are taken in a back room and they have their clinical navigators working not necessarily on reception but in other areas. I can't comment necessarily on the circumstances because I don't know the practice that you're referring to.
Well, it's been complained about anyway, but I do feel, you know, that sometimes it's a bit like call my bluff.
Yeah. So
and as I said, I'm not saying that the practices are not overworked. They are, and they've got all this paperwork to do. But sometimes things are not worked properly, in my opinion.
Yeah, and that's not you know, that's a valid opinion, and it's something that we're working hard to make sure that we have information so that we can help practices that aren't filling their capacity as well as other practices might be, to make sure that we can give the support and target some of the support to the areas that need it the most.
Thank you.
Thank you for that. Matthew, I think we can come to you next.
Yeah,
Welcome.
hi. Thanks very much, Sue. And I just wanted to say, well, a couple of things quickly. Firstly, in responding to the last lady there, or to give an alternative viewpoint, certainly at my surgery, Heath Lane Surgery in Earl Shilton, I needed to see a doctor yesterday. By the time that I realised that I needed to see a doctor, it was quite late on in the afternoon. I called. It was something that could have been, it turned out not to be, but could have been potentially serious. And I had a phone call back from the doctors, and within an hour I was at the doctor seeing the doctor. So I mean, you know, it couldn't have been a better kind of service from that perspective, from Heath Lane Surgery yesterday. And all I would say is that, you know, I mean, yeah, I'm sure sometimes there are practices that could be done better at GP surgeries, but I think we need to remember that our doctors' surgeries are worked off their feet at the moment, and I just think we shouldn't always make assumptions that just because we can't hear something or just because we can't see something, that it means that they're all sat in the back room having a fag. I mean, it's clearly not. That's clearly not the case. But I also wanted to make the point about misinformation. And on social media, I'm seeing a lot of anti-vax stuff, a lot of anti-mask stuff, a lot of stuff around, you know, people can never get a doctor's appointment and all of this. And I'm just wondering, I know there's no easy answer, but, you know, do the CCGs have any thoughts around how PPGs could potentially help say what is really going on and to counter that misinformation? Thanks.
Yeah, and I think certainly just from a communications perspective on that latter point, Matthew, I think you can, particularly if you are part of your own social networking, we can make sure that the messages that we are trying to get out there and really amplify that you're receiving, so that you can send them on, so that they are consistent with sort of national and local messages. So what we can do is, I think we need to resend some of the toolkits out to you, but also to make sure that this group is on those links to social networking links that we've got, that you can really send out information broader. Although we do a lot of what we term as organic, so we are part of a lot of community groups, you know, there are hundreds upon hundreds of them out there, so there's always more that we can do. So I will make sure that as an action we take that up, Matthew. So I'm just conscious on time, because obviously we said we keep it to an hour, so we're fine on time at the moment, but I want to get a couple more questions in. So I'm going to come to Dinesh first and then Alan, if I may. So Dinesh, welcome.
Sorry, it's not Dinesh, it's Barty. We normally share the computer, right?
Oh, right, question. Okay, no problem.
Right. I've had both experiences from the GP surgery. I rang continuously for 10 days, wanting a day appointment. Every time I got through, after an hour's ringing continuously, the appointments were gone for the day. So on my 11th working day, I just happened to say, I've been trying for the last 2 weeks trying to get an appointment. Then she recommended an appointment with the pharmacy, which was very good advice for them.
Sorry about that, Alan.
It's all right. I'll go and make a cup of coffee till we've finished.
No, you.
Just to say, on the business of letting patients know what's happening, what's available, we have, well, the practice did it, and the PPG were invited to amend it slightly, which we did. We have sent a letter out to every patient in our practice, letting them know how the surgery works, what services are available, etc. So all our patients really have no excuse for not knowing how the system works. But going back to whoever said it earlier, it is a real problem. There are not enough appointments in the day, whatever the surgeries do. And my question that I put in chat earlier is, can the CCG provide some extra money to get extra appointments in, or pay for late working of GPs somewhere or other, to stop the push towards people going to A&E? I have a friend that spent similar to that other lady, spent 4 days trying to speak to practice and gave up. And in the end went to the urgent care centre at Loughborough. Didn't know that they could do 111 to get a fixed appointment. They were there for 4 hours. And the first thing they said is, we don't know what to do. We're getting so many patients here who can't get an appointment at their GPs. So it's a Leicestershire issue. It's nothing else. And I know the GPs work really hard and long hours, but there must be some way, some money could be made available to lengthen the GPs' days.
Thank you, Alan. And yeah, absolutely. And sadly, it's not a Leicestershire issue. It's a national issue at the moment. And I spend a lot of time talking to colleagues across the region and across the nation. And it's a very similar picture in all of those areas. So in terms of money, we do have some money available, and that is being made available. But one of the challenges that we've got is money isn't necessarily the answer. The workforce is really, really challenging to get. So even where we are trying to make money available to practices and to primary care networks, if they can't actually access the workforce with the right skills and abilities, then actually they're in no better position. So yes, we do have some money available, and we have some non-recurrent money available at the moment, which we are working with all of our providers to say, you know, could you use this money, and how could it help you? And the narrative that we're getting back from them very strongly is that they're finding it incredibly difficult to find staff. So that's not just doctors, that's also nurses, that's also therapists. So it is very challenging at the minute, but I don't think it's just a money issue. I think it's a little bit broader than that.
But Rachel, can you not see if you can find any locums to help?
Yeah, and that's exactly what they're doing. But when demand is quite as high as it is, you know, everybody's fishing from the same pond, if you like. So there are some doctors that work on locum contracts, but again, there's a lot of people who are vying for those locums. So it isn't as easy as just kind of having some money to put towards this. We need a much broader piece of work around kind of a sustainable workforce, and a workforce that is able to respond, because of course, in the same way as the rest of the population have been impacted by greater sickness and absence, as have our health professionals. And so, you know, often, particularly if you've got staff who are parents that are called away from work suddenly because their children are being sent home from school. So it's been a really difficult time to manage.
Thank you.
Thanks, Rachel.
Thanks for that, and Alan, it's a really good point. I can't see any more hands raised. We've got, I think we've been answering some of the comments in the chat box. We've got Alan Plumpton, patient education is where much of the problem rests. People still try to insist on seeing a GP, and I wonder how well used 111 is. What are the statistics about numbers of people accessing 111? I wonder, Rachel, are you able to help with that question?
So 111 we know isn't used as much as we would like it to be used, because we think that it would be a really it is a great way of navigating and helping people to choose wisely in terms of choosing the right service to meet their need at that point in time. Again, there's been some negative press around 111, which is a shame, but actually, so we're trying to increase the number of people that are accessing 111, and we would really like that message of kind of talk before you walk, and use 111 to identify for you where is the best place to go and follow their advice. We're just about to one of the problems that we've got is if somebody calls 111 at the moment, they have to remember everything that's said to them, and they have to try and kind of navigate the system outside of that. What we are about to start piloting is a text messaging service. So once somebody has contacted 111, they will have the option to receive a text, and that text will lay out for them very clearly what advice has been given. So if they then go to the GP, they can show the GP the text to say, this is what 111 said to me. Or similarly, if 111 do say to them, you need to go to accidents and emergency or ED, however people term it, you know, they'll have a text there to show people, which will make it make that advice much more robust, actually. So I think that will be helpful. But again, in terms of your messaging to people, and I appreciate everything that you guys do to support us, you know, using 111 is the best way to get a good understanding of what services are available, which services are most likely to meet your need, and actually the best way to access them, because the people that are experiencing long waits at Loughborough and places like that are the people that are walking in without an appointment, and having a set time appointment is much better.
Thank you. So I'm just going to take one more question on this because I'm just conscious on time. I'm just going to go to somebody that we haven't heard from. So Karen, I think you mentioned that Pam would like to ask a question.
Sorry. Yeah, so seeing all your points and seeing what you're saying, but 111 hasn't been very accessible for the deaf community, because quite often they're having to make these calls through their family, but we like to do this independently and we can't access by text. So for example, when a doctor texts me, I can't respond. I can't access many of these services. So we need to make some better improvements for deaf people, how they access 111.
Yeah, absolutely, Karen. Thank you for that. And I will absolutely take that away and find out what specifically is happening to make sure that we are making 111 accessible to all of our patients and all of our population. I think that's a really valid point. We have to make sure that our services meet the needs of everybody that they're there to serve.
Okay, that's lovely. So I am going to draw that one to a close now, just really in the interests of time. So thank you all for your questions. I know it's one of extremes, isn't it? And we always hear very positive things in terms of our services, but we also hear things that we know that need to be improved into the system, and we will pass on your message I think Matthew as well, just to thank our local NHS staff for all they're doing, and I'm sure Rachel will take that back to the urgent and emergency care group. But notwithstanding, we know that there is a lot of work that we need to do going forward. So I've also got and I know you mentioned that you sorry, I'm just yeah, and I think you mentioned you arrived late just on the COVID vaccination. So I don't know, do you want to just ask your question on that?
Yeah, the question was, it's the confusion between a third dose and a booster dose. And I think I and other people are confused. Is there a difference, or are they actually the same, but just got two different names for two different categories of people?
So, Joe, I don't know whether there was anything on clarification, or whether, I think probably we're just going to need to make sure, because we haven't got a clinician on the call today. Can we come back in the notes to you on that?
Yeah, I can find out. I don't personally know the answer to that, but that can be easily resolved. So I'll find out, and I'll send an email to all of the PPGs with the answer to that.
Lovely. Okay, thank you. So just going then back to the agenda, and I'm only going to spend a couple of minutes literally on this, because I do want to then have the last agenda item so that you've got the opportunity of sharing what's happening with you. But before I do that, Rachel, can I just thank you for your time? I really appreciate it, because I know how busy you are in the system at the moment, but I can tell by the discussion that people have found it really beneficial, and I think it's something that we need to keep that dialogue up with you in future meetings. So thank you very
Rachel.
much.
I'm going to leave, but I do appreciate the conversation. Thank you very much, and I will stay in touch and try to make sure that myself or a colleague can join you whenever that would be helpful.
That's fantastic. I think it's going to be more important than ever over winter. Lovely. Thank you, Rachel. So as I say, I'm going to keep this really tight because we can share the slides with you, but we did just have some questions in terms of our current structure, because the clinical commissioning groups, obviously quite a few months ago, did come together. The three individual clinical commissioning groups across Leicester, Leicestershire and Rutland did come together as one overall team as we move into something that we will talk to you about at the next meeting in terms of integrated care system. But we just wanted to very quickly say that at the moment we've got 5 directorates now within the overall organisation. So nursing quality and performance, and that really does what it says on the tin in terms of making sure the performance is right, the quality is high, and obviously looking after that important clinical element. Obviously, we've got a big job in developing strategies and plans for the future, and continuing to do the work to transform services and integrate them, particularly with social care. So that's part of the integration and transformation. And then there's all that keeping us running in terms of those all the really important back office, making sure our finances are good, we're contracting correctly, and more our governance is tight. So we come under people and innovation now in our directorate. So if we can go into the next slide, so that's communications and engagement. So we've got 5 areas in our overall team. So human resources comes into that, and one of the key elements of that human resources is making sure that we are looking to support our workforce is in the future, and making sure that nurses in the system, GPs in the system, that we know what our requirements are in the future, and we're building on that. Equality and diversity, obviously really important that we make sure that services going forward that meet the needs of the entire population, and that we don't have inequality in terms of care, that we're thinking about everyone. Obviously performance and monitoring. So, some of the important issues that you've been bringing up really come under that performance monitoring and improving things, particularly as we come out of the pandemic, or we go into the kind of next phase of the pandemic, and also business intelligence, and that is key to everything that we do in our business, and is quite broad. So just to share with you who then the communications and engagement team are, because some of these might be new names to you. So we're headed up by our Deputy Director, Richard Morris, who may be known to you. We've divided engagement and insights up in communications. So I head up the one part, and my colleague Dave Rowson heads up communications and marketing, and heavily involved in obviously all the COVID work. Then I won't go through the individual names of people that sit in those two sides of those teams, but obviously we've got a huge amount of work that we're doing in the engagement side of things, around making sure that we are moving forward on those individual place-based plans, so individual improvements, like improving services in Melton, in Lutterworth, as well as looking at it from a whole Leicester and Rutland. And we are really trying hard that we make sure that we are hearing the broad patient voice, and have developed lots of systems over the last 2 years to do that. So we're using the traditional methods as well as really tapping into digital. So there's a whole range of services, but also in terms of communications, a lot of the work that are around on campaigns, and press and public relations that we know that you help us with. So that really is us. So as I say, we will share that structure chart with you. I've just got Matthew, you're saying really pleased to see commitment to equality and diversity as a member of LGBT and communities is something I care about a lot, and I look forward to future engagement on this. And I think that's a really good point, Matthew, because we are going to be doing a huge amount of more dedicated work on that in our engagement strategy going forward. So I'm just going to ask to stop sharing the slides at the moment, because I do just want in the last few minutes to open everything up to you, and I am conscious that maybe not kept enough time for this, but I just want to open it up to you and tell us what is happening in your PPG, in your practice. So I've got a couple of hands raised. So I've got Alan first, and then Phil. So Alan, can I come to you first?
Yeah, this communication structure that you just talked about is a thing I raised with Joe, because we haven't got a clue who's who. Now, what you've put is a list of job titles. Those job titles don't give us a clue of what those individuals do. And we need a description of what the various job titles actually mean in practice.
So, I mean, if it's with regard to who you contact, the easiest way is to use, as Joe referred to, is that be involved inbox. You don't need to be inconvenienced with individual emails, because it could be that it's somebody broader than our team. So I would encourage you to use that be involved, and then it will be our headache to actually make sure that you're inquiries are going to the right person, whether that is somebody within the communications and engagement team, or whether that could be in other teams, to make sure that you get a timely and accurate response to your inquiry, really. And then on
finish off, sir, and I'll come back.
Yeah, and then, as I say, on a various basis, we do invite, as we've invited to today, people like Rachel to the meetings. We will, and we've all, at the last meeting, we obviously invited Mel as part of our communications team. Then we'll make sure that those people come to this meeting so that they can, you can meet them directly.
Yeah, we appreciate that. That wasn't my point. My point was, if it says so-and-so's title is an insight officer, what does an insight officer do? So what I'm saying, as well as the job titles, we need to know what those job titles mean.
So I think that's a whole different session, isn't it then, Alan? Because I haven't kind of got time to go through that today.
No, I appreciate that.
If that's useful to you, then we can tell you a little bit more about what everybody does.
Yeah, just quickly, not to hog it, but when you do the send out the screen with the structure, a few lines on what each person does would save a lot of time.
Yes, certainly we can do that. I mean,
that'd be great.
What we'll do is we'll send slides out to you as they are at the moment, because it will just take us a little, a few minutes just to put those on. So if you can do that, and then if there is another session that we can hold in terms of what we do.
Thanks, Sue.
Julie, do you want to come back in? I think you're on mute at the moment, Julie.
Yeah. You should hear me now. Can you hear me now?
I can, yeah. Lovely, thank you, Julie.
My question is regarding PPGs and the network practice PPG. I would like to ask how many people have tackled this within their network practice group. We as a practice have had 2 meetings of our own practice meeting. But then last month we had our network group practice meeting, PPG. We met in person, 3 years ago now, we had a room and we all met all the different PPGs that were in our group. And then, as I say, last month, we actually had a group meeting. And I'd like to know if anybody else has done that and how they found it.
So does anybody want to come in with thoughts and ideas for Julie?
I mean, we've got our own ideas, and the idea that we've come up with is that all the individual PPGs should have their own meeting and then bring points to the network group meeting. Obviously, you can't open it up to all the members of the PPGs, but you could open it up to at least 2 members from each PPG group who are going to bring their points to the main PPG group, if you know what I mean. So we can help each other like we normally do.
I think that's a really good point, Julie. I mean, to be honest, we would be delighted. We've got no restrictions on this if so anybody and everybody from the PPG networks can attend these meetings. It's not restricted. So, if people want to come along, that they're more than welcome to. But Karen, have you got something you wanted to bring in there? And then Nisha, and then Matthew.
Yeah, just to say that at our PPG at Castle Medical, we've done everything on Zoom since June 2020. We've held meetings at least every 6 weeks last year, and this year we've been doing them every month on Zoom. In what are we now? So September, we held our first face-to-face meeting. I managed to get a room in Ashby that was nice, with windows to open, COVID, with the flow of air, etc. Some people weren't happy to come face-to-face then. So we did it. So I set up my laptop in the room and we had Zoom on the laptop and about 7 or 8 of us in the room as well. But Alan at Markfield has been brilliant at as well as doing our locality PPG meetings. We haven't had one face-to-face yet, but we've had at least 3 or 4 on Zoom. And our federation, GP federation manager comes along on those as well and gives us a lot of insight. So that's how we've been working. A lot of that locality stuff is down to Alan at Markfield. Thank you, Alan.
Yes,
Thank you.
Yeah, thank you, Alan. Thank you for that, Karen. So
Okay.
I'm conscious that I've been absolutely appalling at chairing this meeting today, but I do want to get the final 3 in that have got hands raised at the moment. So Nishi, do you want to come in? Then I'll come to Matthew and then Jan.
Sue. Well, I wanted to just say thank you to everybody in this group, but also recognize that, you know, as a communication expert myself, I know the role that all the, you know, team members play. You showed the structure of the whole communication department, and it just I just wanted to go out and say, like, thank you very much to all the team members. Most of the time it's not being recognized quite well by all the CCG team members as well. So I just wanted to say thank you for everything that you're doing, be it in the insights team or the internal communications or the campaigns team. I personally work as a global internal communications partner for a company, and I know the work that is involved in sharing all these updates with the relevant stakeholders and target audiences.
Very kind of you. Just a bit taken back, really. Thank you for that. I will pass that on to the team, because I won't pretend over the last couple of years it's been easy, because it hasn't, and we've been working some long hours, weekends and evenings. So I do appreciate that. Thank you. Matthew and Jan.
Yeah, so just very quickly, Sue, thank you. Just following up from, I think it was Julie there. To be honest, I can get a little bit confused about which PPGs people are talking about, because here in Hinckley and Bosworth we have obviously our own surgery PPGs, then the locality PPG, which hasn't met in a while and hopefully will start meeting again soon, and then I consider this to be the network PPG. So is Julie referencing her locality area meeting?
Hi, it's Julie here. I'm talking about the network practice group PPG. You know, where your surgeries have been put together in groups.
Yeah, but like locality, yeah. Okay.
You call it locality, we call it, you know, the practice networking group. Okay. But that's the one where, you know, we can share good practice with each other, because it becomes very evident that a lot of PPGs are not as well informed, shall we say, as others. And it's so good to be able to share good practice that other people can then bring into their own. But because we're in the city, we have lots of languages to contend with. So it's better for the individual PPGs to have their own, and then bring it to our joint network one, with people who can, you know, understand, and we can talk together, because we've got some brilliant interpreters that will work within their own groups.
Great. Thank you, Julie.
Lovely. So I'm going to give Jan the last word, if I may.
Well, that's a treat. In general, not just with you, but just in general. Thank you. Just to say, our PPG has been meeting on a monthly basis throughout the pandemic, because we thought it was really important. And we have become a bit parochial, because we've been firefighting. This has been like nothing we've ever experienced. And the issues that have come up have been, in some instances, quite negative. And that's not something as a practice we have experienced before. So it's been trying to firefight that. What we have done is we have split down and trying to work with sort of subgroups within our PPG. For instance, we're developing quite an intensive communication strategy with the hope that we can get out to all of our patients. As I said, there's 27,000, so it's quite a big job. When we have done that, we would be more than welcome to share that with a wider community. But as I said, at the minute, it's a bit like getting our own house in order. So that's been the way that we've been working. But again, attending these meetings, and we always used to attend the larger PPG network meetings, we're more than happy to share any practice that we have and to hear from other people, you know, what we can actually incorporate in ours. So that's our current position.
Lovely, thank you, Jan. And it does sound as though, you know, I think we probably could have had a bit more discussion around that and sharing. So we will make sure that we're picking that up for the next meeting.
Thank you.
So as I say, my apologies that we have overrun, but I really think that just lengthening those discussions and getting those questions were really useful. So I hope that you found that too. We're going to make some commitments in terms of making sure that we are getting a series now of these meetings in the diary so you can better plan going forward. So we'll make sure we're communicating those out to you. We'll make sure that any questions that are in the chat box that we are coming back to you, getting the slides out and just picking up the various other queries. But can I just thank you for all your time, your enthusiasm and your commitment. It's just amazing, and I appreciate that things have been difficult for you as well, but thanks for all your work. I will see you next month and we'll get the date out ASAP, but we will communicate with you in the interim time. So thank you, everybody.